Listen as your day unfolds. Challenge what the future holds. Try and keep your head up to the sky. Lovers, they may cause you fears. Go ahead, release your tears. Stand up and be counted. Don't be ashamed to cry. You gotta be bad. You gotta be bold. You gotta be wiser. You gotta be strong. You gotta be hard. You gotta be tougher. You gotta be cool. You gotta be calm. You gotta stay together. All I know is love will save the day. Herald what your mother said. Read the books your father read. Try and solve the puzzles in your own sweet time. Some may have more cash than you. Others take a different view. My, oh my, hey, hey. You gotta be bad, you gotta be bold, you gotta be wiser. You gotta be hard, you gotta be tough, you gotta be stronger. You gotta be cool, you gotta be calm, you gotta stay together. All I know is love will save the day. Time asks no questions, it goes on without you, leaving you behind if you can't stand the pace. The world keeps on spinning, can't stop it if you try to. The best part is love is staring you in the face. Remember, listen as you unfold. Challenge what the future holds. Love is leading up to the sky. Others, they may cause you tears. Go ahead, release your fears. My, oh my, hey, hey, yeah. You gotta be bold, you gotta be bad, you gotta be wiser. You gotta be hard, you gotta be tough, you gotta be stronger. You gotta stay calm, you gotta be cool, you gotta stay together. All I know is love will save the day. You gotta be bad, you gotta be bold, you gotta be wiser. You gotta be hard, you gotta be tough, you gotta be stronger. You gotta be cool, you gotta be calm, stay together. All I know is love will save the day. You got to be bad, not so bad. You got to be wise, hey, hey, hey. You got to be hard, but not so hard, hey, hey, hey. Ooh, ooh. You gotta be bad, you gotta be bold, you gotta be wiser. You gotta be hard, you gotta be tough, you gotta be stronger. You gotta be cool, you gotta be calm and stay together. All I know, love will save the day. All I know, all I know, I know, hey, 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 hey. All I know is love, love, love. Love will save the day.
Oh my, wow, wow. Thank you, Anita Jackson. You have done it again. Love will save the day. What a powerful message. What a powerful performance. Yes, greetings. Welcome to Lighting the Way CHIPS Health and Wellness Center's 30th anniversary virtual gala. I'm your MC, Joel P.E. King, and I am excited to be with you as we celebrate the journey of an organization that has been a beacon of light in the St. Louis community for over 3 decades. Amazing. We are celebrating where we have been, where we are going, and where we are right now. We celebrate the many supporters CHIPS has had throughout the years, supporters who have made it possible to continue to touch the lives of, listen to this, over 100,000 people since 1990. I'm fortunate enough to say that I have been one of those people and continue to be a client who has benefited from the compassionate care CHIPS offer to those who are most in need. I will tell you more about my story later. And of course, this cannot be done without our supporters, our sponsors. So thank you to our sponsors for this event: the Hunter Family Foundation, Centene Corporation, Emerson, Busey Bank, Midwest Bank Center, Goldfarb School of Nursing at Barnes Jewish College, Betty Jean Kerr People's Health Centers, CARE St. Louis Health, St. Louis Children's Hospital, and St. Luke's Hospital. And hear me when I say this, we could not do what we do without you, and we are truly grateful. Thank you also to the CHIPS Board of Directors and the CHIPS Advisory Board. And thank you to our consultants. CHIPS Health and Wellness Center's mission is to promote wellness and empower self-health and management for the uninsured and underserved through preventive and primary health care services. Over 93% of patients are African American. All CHIPS patients are low income, uninsured, and underserved. CHIPS Health and Wellness Center, a member of the National Association of Free and Charitable Clinics, has provided free health care services to residents of the St. Louis metropolitan area for 30 years. Services delivered by volunteer providers included primary and preventive health care for adults and children, psychiatry and counseling, dental care, chiropractic care, vision care, chronic disease management, and support groups. Oh my gosh. Tonight, we will hear from some of our providers and some of our clients who will share their heartfelt testimonials. We will also be entertained by the mesmerizing talent of vocalist Anita Jackson and an uplifting performance by Club CHIPS. For those of you who have been loyal supporters of CHIPS over the years, we are so grateful for you. As you know, your financial contributions and countless volunteer hours are the lifeblood of this organization. We could not do what we do without your support. For those of you who are new to CHIPS, we thank you too for spending this time with us. We invite you to become financial supporters this evening, and we welcome you into the CHIPS family. This is a celebration and a fundraiser. Our goal for the Lighting the Way campaign is to raise $300,000. As of this evening, we're not quite halfway to our goal. But with your support, we can reach and even surpass our goal by the end of this month. With your help, I think we can do it. I know we can do it. There is no donation too small, and of course, none too big either. Donations can be made throughout the event. Feel free to donate as many times as you would like, and as much and as much and as much and as much as you can. Give us the money. And there is a special surprise. Y'all knew that was coming, right? We are selling raffle tickets for a 7-day stay at a luxury 2-bedroom condo at a destination of your choice for one of these fine locations. Raffle tickets are only $25. $25 each, and 5 for $100. You know what, I think I'm gonna do the 5 for $100 because I wanna win this trip. So to buy raffle tickets, stop what you're doing right now and go to the link below. You will see the choice for raffle tickets on this link. The winner will be randomly selected on A King Was Born, July 31st. So you have until the end of the month to buy tickets and to get your family and friends to buy tickets too. Tell them to buy tickets. Everybody buy a ticket. Friends buy a ticket. Mama buy a ticket. Daddy buy a ticket. Buy a ticket. The winners will be contacted and posted on your website and Facebook page. Don't delay. Don't deny yourselves. Get those tickets and make those donations. We are going to have a good time together this evening. We encourage you to call your friends right now and invite them to this party, because we're having a party, y'all. We don't want anyone to miss out on an opportunity to become part of our family, the CHIPS family. Let's keep things going with a word from the Gala Committee, co-chair and CHIPS board member, Dr. Bernard Shore.
Good evening and welcome to tonight's virtual gala. I'm Dr. Bernie Shore, and Sharon Pace and I are representing the CHIPS Health and Wellness Center Board of Directors as co-chairs for tonight's 30th anniversary event. I first joined the CHIPS board almost 9 years ago when I first learned about the unique role that CHIPS plays in providing free health care for the underserved and uninsured in the St. Louis area. In addition to serving as a critical access point for basic dental, medical, vision, and psychiatric care, CHIPS also provides and participates in multiple community health and wellness activities. This includes support services for seniors, health screening services, diabetes support groups, and youth engagement programs through Club CHIPS. I know that everyone will enjoy tonight's Club CHIPS performance and will be very impressed by these high school students' talents and by the message that they are communicating to their peers. Tonight is a celebration of CHIPS 30 years, but it is also an opportunity to ensure that through our generosity, CHIPS will continue to promote wellness for the uninsured and underserved and help to ensure that everyone in our community has access to affordable and quality health care and social services. Thank you to all of our sponsors and to everyone who has contributed to CHIPS.
I really don't know if this can just get any better. Thank you, Dr. Shore. And now I am here with Judy Bentley, founder, president, and CEO of CHIPS. How are you, Mrs. Bentley?
I'm very well, thank you, Joel. It's good to be here this evening with you.
It's good to have you here.
Well.
You know, I'm always excited to see you, y'all. I'm sure you know that.
Yes, I do know
Every
that.
time.
and it's a mutual feeling.
So are you ready for this Q&A we're about to have?
Oh, absolutely.
Okay, I need you to relax, though.
Okay.
Go ahead, sit on back.
Do I have to
sit back?
If I sit back, I might go to sleep.
Sit back like a CEO.
Well, CEOs like me, you have to stay, you can be a guard. You can't sit back. Okay. So.
Okay, there we go. Point taken.
I can lean.
You want to lean?
I lean.
Just lean.
I lean good.
Can we lean both together? You ready? On three. 1, 2, 3.
Hey.
Yeah. All right, I like that. Okay. Question number 1.
Yes.
How and when did CHIPS start?
Well, it started in 1990.
Ooh.
Yes.
I was 10.
1990. We were part of a community rustling because resources in our community were dissolving. Members of the community wanted to do something to salvage what was left. One of the leading healthcare centers went out of business, so it left a huge number of people underserved. Well, we thought that we didn't have the resources to build another, it was a federally qualified health center. So the pastors of the 3 churches that we eventually started to communicate with were being disturbed because members were coming to them for resources, and they realized they couldn't provide that. So we had a couple of, several people who were in the healthcare field. We had the pastors of those 3 churches and other community members. We got together and we said, what can we do to salvage what's left and build on what needs to be done? So we had several community meetings, and it went well. What came out of that, however, was an overwhelming list of needs, which we knew it was going to take more resources than we had. So it becomes a creative process on how you do that and meet the greatest needs. So we did a health fair. It was the first time they'd had a big health fair like that.
Oh, wow.
And they gave me the privilege of putting that health fair on.
Oh, I bet it was amazing.
It was amazing.
Yes.
And the response from the community members was like, wow, what else can we do? Well, a generous benefactor was able to underwrite a health resource, and we didn't know what that was going to look like. Well, the pastor of St. Teresa at that time asked me to start something in healthcare. And I asked him, what does that mean? What does that look like? I am a nurse practitioner, practiced for 15 years as a women's health nurse practitioner. familiar with the healthcare system, knew that it was a very costly system, and to do it right, you had to have, resources.
So you were retired during that time?
Well, no, I was at another place.
Okay.
I was at another center, and thought I was going to be retiring.
Okay.
So it turned out that the benefactor underwrote us in a modest way. And when I asked the pastor, what is it that you think we should be doing? How do you want this to look? And I'm going to give you verbatim what he said.
Okay.
He said, hell, I don't know, you're the expert. So that gave me it gave me an opportunity to do a nurse managed model.
Awesome. So let's talk about a few things. We've discussed like who does CHIP serve through some of the conversation and the information that have been projected already. So, but where would you say like the demographic? Where do the CHIPS clients live?
Well, we thought that we were going to be, at the point that we started, we would do the uninsured and underserved. I got to name the service, Community Health in Partnership Services.
Okay.
So I knew that whatever we started, it was going to have to be in partnership with area organizations. So we serve those people who are in the immediate zip code of 6106, 07, 13, and 15, but it turned out that we have like 90 zip codes of people who have come through CHIPS and who are taken care of.
So I'm going to do we'll say the question round. I got quick questions, quick answers, and because I think these are very important. Do the doctors and nurses get paid?
No, they don't. We have a small paid staff of nurses, like 4 of them are on payroll.
Okay, and how much does a patient have to pay to receive care at CHIPS?
Patients don't pay to get care at CHIPS. We have a required $35 a year membership fee, but they can't afford to pay for what they get.
And last question, how can people best support CHIPS?
Oh, well, that's my favorite question.
Yes.
One of them is through volunteering.
Okay.
The other one, of course, is to donate. You can hit the button right now on the screen.
Now we got to lean into it because we're talking like a CEO.
Yeah,
you want to what?
Going to lean into.
Yeah.
We're going to hit the button.
Hit the button for.
To make donate now.
What's our goal?
Right, 300,000.
Okay. All right.
So we need that.
Yes.
You can also be a part of our fundraising activities other than this, but make sure that you sign up to be an ongoing supporter.
Talk to the
of
people.
Club CHIPS. So I need you.
Yes.
CHIPS needs you.
Yes.
The uninsured and underserved need you.
Yes.
Our children at risk need you. That youth leadership program that you're going to hear more about, they need you. This community is underserved, and you can make a difference in building a healthy and a productive community.
You can make a difference. You've heard it here, you all. Donate, donate, donate. And one last, got a bonus question for you. What is the most rewarding aspect?
Well, I'm going to say to you that we have had the privilege of being recognized nationally.
Oh, awesome.
As a organization that meets the needs of the uninsured. And that recognition was from Robert Wood Johnson Foundation, which really put us on the national scale of a model that works for those who are uninsured and underserved.
Let me say thank you again. Thank you again. Thank you for joining us today and sharing your story. I want to take this opportunity to share with you and our audience a piece that's been on my mind. I hope you like it. Tick tock, tick tock. Can't stop the rain of destiny while the sun shines down on me. Tick tock, tick tock. In just moments, I will be the first sibling with a college degree. Tick tock, tick tock. It's like a Greek tragedy. Yes, I'm being dramatic, but the times were real, you'll see. absorbing all the lessons I've learned, mending the bridges I've burned, considering the heads I've turned and the rewards I've earned. So much to see, so much to be, just to still be unsure what to do with this degree. Tick-tock, tick-tock. But this was the way to go, yet nobody really knows. These intense trials, though hard, was minute. Really, I was searching for my soul. I had lost everything from my jobs to my keys that controlled everything. I'm talking about from the roof over my head to a car that at times was my bed, and yet the only thing that lies ahead are some theatrical shows and some friends' sofa beds. I am just trying to figure this out, what I was told and what's come out. Let me get over that first before I dare to be present, because there are too many things wrong with these things in the present. What blatant discoveries of the many silenced communities, the violence, the killing, has built its own immunity, no longer blinded, because now I truly see the world is suffering from all this misery. Misery of pain, misery from strife, misery from hopelessness, misery from life, misery of life. Yes. These were the dilemmas trying to get my attention, all while my body wasn't feeling well, perhaps from all the tension. Tick-tock, tick-tock. My time has finally arrived, so I stepped in from outside just to be greeted with these smiles. From the front desk of Teresa, who felt like Jesus greeting you, to the staff of constant hellos. How can anybody be mellow? They just knew what to do. It is now my turn to see the good doctor. This was cool, but who knew what would follow after? I came in here for physical treatment, forgetting what was wrong, what was going through my mind. You're needing some mental treatment. They assure me that I'll be just fine. Why? Wow. I'm seeing a therapist for the first time in my life, while seeing the world in full view for the first time in my life. What better people to walk into this unfamiliar road? They gave me the best services. Oh, what a lift from the heavy load. No pretense, only security. I think that was about 2003, a post-college graduate forced to embrace my maturity. Almost 20 years later, and CHIPS is still the clinic I'll come and see for health care, mental care, and even acupuncture. How could this be? Not that they're providing these services, but back then, it all was free. Thank you, Kathy. Thank you, Mrs. Bentley. Thank you, Mr. Bentley. You and your team are who I call family, because through you, by you, for us, all these cares and woes were just a stroke of the pen and some typical paperwork. It's not just making us better, but it's making us whole.
Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. Please swallow your pride if I have things you need to borrow. other when you need a hand. We all need somebody to lean on. I just might have a problem that you'll understand. We all need somebody to lean on. Somebody to lean on.
Oh my, what are y'all trying to do to my heart? Thank you. Thank you, Essence Tyler, for that beautiful song, Lean on Me. CHIPS has been able to be that pillar for so many to lean on through the years. There are so many ways that your financial support can help CHIPS continue to be that light for those who are uninsured or underserved. Let's hear from some of them now.
CHIPS is a very nice clinic because it helps the community. It helps people like me who really can't afford health care. And it's very important that we have something in our community to help us out. My income fluctuates, and sometimes I can't afford health care. And it's important that they have places like CHIPS that we can come to and get some help, because we all can't afford health care nowadays. And it really helps me out, because if I didn't have CHIPS, I wouldn't know what I would do.
Me and my wife relocated here from Washington State, so we had no insurance. That was the big deal. And I'm diabetic, and she has thyroid problems. So we had enough medicine when we left for a few months, but then the pandemic hit in March, and neither one of us was eligible for insurance. So we ran out of medicine. We both say they saved our lives.
This feels like home. You know, when you go to a doctor or to a clinic, you want to go somewhere where there's a nice atmosphere, where the people are nice and the nurses are nice. I haven't had a bad moment here. So that's why I'm gonna keep coming. And like I told them, they're gonna have to put me out. In life, we never know what a person is going through. You know, and just to hear a kind word or to see a smile or just, you know, just a hug, anything, you know. And every time I come here, that's what I get. Before CHIPS, I didn't even have a clinic. I didn't have a primary doctor. I didn't have anything. Myself and another coworker of mine, we were just trying to figure it out, you know. But I knew that I needed to have a place to go. I knew that I needed, you know, simple things like you know, a breast exam, or, you know, find out about my blood pressure, because I had started seeing spots before my eyes and didn't know what was going on with me. So had she not, she was a godsend to me, you know, because had she not came into the office that day and we were just talking about it, and had she not referred me to CHIPS, I don't know where I would be. You know, I may not even be here doing this interview, you know, because I didn't know how high my blood pressure was. I didn't know that I had become a diabetic. I didn't know that.
This program is a blessing. I hope it continues, because I know it can help other people out there that really need it, like me and my wife. And, you know, sometimes that's all you need, is somebody to listen and help you, instead of just, you know, dissecting you and ask you a lot of questions. You never get what you need. And they give us what we need. They listen. They got great doctors, you know, that respond well. So it's a godsend.
CHIPS has been fantastic. I know several people have used CHIPS and it was in situations like mine. In fact, I've told people about coming here to seek out their services, and it's been and they had the same results. You know, they say, "Hey, Wes, thank you so much, man. I didn't know it." First of all, a lot of them didn't even know it existed, and I didn't either. I stumbled into it. A friend of mine told me, and that's what got me here. And I said it was the best thing that I could have ever done. They rescued me. The bottom line is, I felt like I was rescued, and I can't say enough for what CHIPS has done for me.
As you have heard from those heartfelt testimonials, CHIPS is a light to so many. CHIPS has provided a health home to those in need when they had nowhere else to turn. Now is your chance to help us to continue the outstanding work that we have been doing for over 30 years. Remember, we are trying to raise $300,000 today. Let me share with you exactly how your donations will help. $5,000, 1 month of clinical lab testing. $2,500 youth leadership program, 1 month of student stipends. $1,000 diabetic education and supplies. $750, 3 outreach screening events at community locations. And for $500, 5 dental treatments. For $375, 3 support group sessions, Diabetic Support Group and Circle of Friends Senior Support Group. For $200, 4 chiropractic care treatments. For $100, 1 clinic visit for a new patient. $90, 3 case management encounters. For $50, nebulizer treatment, medication support, or mental health counseling. And for $25, immunization. Come on, everyone. We can do this. What's $300,000 when we are saving lives? When we are providing a better quality of life? We can do this together. Together, we can prove that the work CHIPS does in the community is valued and it's valuable. Remember to donate to the Lighting the Way campaign. Please visit the link on your screen. We appreciate you helping us to reach our goal. Help us reach our goal. As has been said, CHIPS thrives on partnerships. This is integral to the mission of the organization. We are so grateful for the providers who have been the heart of CHIPS over the years, who have saved countless lives and have empowered everyone that has walked through the doors of CHIPS. I'm one of them. Since its inception, Judy Bentley knew that she needed to work hand in hand with organizations like Washington University and St. Louis University, 2 of our stellar teaching hospitals. Let's hear from 2 of our outstanding medical partners. Ladies and gentlemen, I hope that you are ready. We are now going to be joined by the specialist, the great, the healer, Dr. Will Ross.
Well, thank you. It's absolutely my honor to be here. On behalf of the faculty and administrators at Washington University School of Medicine, I would like to congratulate Judy Bentley and CHIPS on the occasion of their 30th anniversary. For over 30 years, CHIPS has been a source of care, hope, and inspiration for countless residents in North St. Louis. CHIPS' focus on high-quality, personalized patient care in a community-based setting is one of the reasons our medical students have found their volunteer experiences at CHIPS as one of the most memorable. I believe that healthcare is best delivered in the community by providers and trainees who embrace cultural humility and recognize the social and structural barriers that impede individuals from reaching their highest healthcare potential. The medical students who volunteer at CHIPS have learned that valuable lesson, which will be incorporated into their patient care practices for years to come. They have already become the new generation of empathic practitioners who respect their patients' agency and see them as fully activated collaborators in their healthcare management. Thank you, CHIPS, for giving our students this opportunity, and may you continue to do the work of healing our community. Now, we're going to hear from Dr. Fred Eccles as he introduces Club CHIPS.
Hello, I'm Dr. Fred Eccles, Acting Director of Health for the City of St. Louis. Health equity in the delivery of public health services is a value and a priority for the City of St. Louis Department of Health as we strive to help build an equitable community achieving optimal health for all. The Department of Health cannot do this critical work in isolation. Working together with residents and community partners, increase the likelihood of obtaining opportunities for each person in our community having the ability to attain positive health outcomes. We are fortunate to have a community partner like Community Youth Leaders United for Better Health, also known as Club CHIPS, helping to do this work. Club CHIPS, a CHIPS Health and Wellness Center initiative, is a youth leadership and performing arts program. Having served as a mentor for the program, I know firsthand the health promotion, education, and wellness efforts of the teens in the program. Thank you current and former members of Club CHIPS for the health equity service to our community.
I'm unique, I'm special, I'm one of a kind. No bully or hater can mess with my mind. I'm talented and full of creativity. No one can change the qualities of me.
I'm as fast as I lead with my humor and wit. You know my words make rappers all nondescript, cause I'll make you laugh instead of cry. Cause my self-esteem is so high.
It's so high.
I got my head on straight and my grades are good.
My grades are good.
But don't call me the dummy of the neighborhood.
All right.
I have goals and I have a dream, and I won't let you ruin my self-esteem.
Self-determination is my best quality, and I won't act a fool for nobody. I walk tall and proud with my hands to the sky, cause I wanna have my self-esteem stay real high. I'm gonna try real hard to do what's right. And if I fail, sometimes that's still alright. As long as I can find my way around the fight, then my self-esteem will turn on like a light.
Like a light. I'm proud of my looks.
Hey, oh, oh.
As everyone can see.
Yes, yes, yes.
The way I walk and how I talk.
Oh,
I'm real special to me.
oh. There comes a time to let the negative go, cause otherwise you won't be able to grow. Talking out your problems is a better way than fighting with each other any day. Cause I'm unique, I'm special, I'm one of a kind. No bully or hater can mess with my mind. I'm talented and full of creativity. No one can change the qualities of me, cause I'm unique.
Oh my, just amazing. I'm blown away. I'm blown away. Thank you. Y'all just give the Club CHIPS one amazing virtual round of applause. Just give it one round of applause. Thank you to the members of Club CHIPS for that affirming and empowering message. Performing today were the current Club CHIP members and the alumni. Look at that, y'all. That number that they performed, one of a kind, is an excerpt from the first piece written by Club CHIPS 20 years ago. Wow. Yes, Club CHIPS is celebrating 20 years of impacting the lives of the youth throughout the metropolitan St. Louis area with my friend Hassie Davis as the program coordinator from the inception. I am proud to say that I was one of the first professional performers and teaching artists with Club CHIPS. Come on, y'all. And Vivian Watt, who choreographed the piece you just saw, was one of the first artists as well, and she continues to work with Club CHIPS on a regular basis. Let's take a pause for Ms. Watt and give her a virtual round of applause. Her and Ms. Hassie, a virtual round of applause. Thank you, Ms. Watt, for always sharing your energy, and you got a lot of it, and artistry with the youth. Thank you for that kick. Come on, Ms. Watt. Being involved with Club CHIPS made quite an impact on the over 130 youth who have been part of the program. Let's hear from a few of Club CHIPS alumni.
When I walked into CHIPS, I was 14 years old, and looking back, it was one of the best programs that I could have been in.
I remember all of the plays, I remember the songs. There's just so much that came out of my time with CHIPS that it's just crazy, you know. There were phenomenal instructors. They made sure that we were, you know, educated about not only the play itself and the songs, but the actual knowledge behind it. It was very important to have those kind of conversations because some people in the community may not necessarily be able to have those conversations with parents.
Club CHIPS impact my life because I feel like the lessons and the things that I learned as far as like learning what it is to interview, learning what it is to be a part of leadership or having leadership. It taught me things that got me ready for the work world, for corporate America.
Being in Club CHIPS meant a lot to me. It meant leadership and education and knowledge. I know Club CHIPS was a light in the dark because it not only had health care within the inner city, but it also helped us get to our friends and family and let them know where they can get help should they need it.
I remember the summer trainings where we got a bulk of our information about, bullying, self-esteem, the reproductive organs, about sex. And those were a lot of conversations that kids my age weren't really having. They were really hearing it through their friends. And it was just such a good thing to be able to know the truth.
Not only did they want to go around inspiring people to be, use their talents for a great cause, but also to understand why this is important and why health affects our community so much.
Young people have told us that their lives have been affected in ways that they didn't realize they were being bullied, or they didn't know that they were in trouble. And one of the young people in our program, well, actually several when I think about it, have had friends when they were considering suicide, they called a Club Chipper to help them get help. So the impact is immeasurable.
There were so many great relationships that were built out of there, even from, my husband being a former Club Chip member and thinking about, us having a daughter and what that would necessarily mean for her future. I don't know, maybe she'll be a future Club Chips member.
When you're growing up and you are coming into being a teenager and a young adult, you start to figure out who you are as a human being and where your place is. CHIPS have always been a safe place to grow, to learn, to develop, and also educate.
See, I told you, CHIPS has been and is doing great things. Don't you want to be a part of our story for the next 30 years? Don't worry, we've made it easy for you to be a part of the family. You can donate now at the link on your screen. You can also buy raffle tickets to win a 7-day stay at a beautiful luxury condo. We would be remiss if we did not recognize the hardworking and compassionate staff of CHIPS. Thank you so much for all of your hard work and dedication. On behalf of the Lighting the Way Gala committee members, I thank you for spending this time with us. Thank you for the support and love you continue to offer to CHIPS. Remember, your support tonight and through the month of July will help us continue to be a guiding light in the community. Don't forget, go to the link below to help us get to our goal. I leave you with parting words from our President and CEO, Judy Bentley, followed by a closing song from the mesmerizing Anita Jackson.
Well, thank you, Joel. Telling the story of community health and partnership services, known as CHIPS Health and Wellness Center, is one of my most favorite things to do. It is a God-given gift to our underserved residents in our communities for over 30 years, out of love and a commitment to make a difference. Volunteer physicians, nurses, other healthcare and lay professionals have shared their skills and talents to light the way in improving the health care of the uninsured and underserved. I am grateful for our current medical staff because of their commitment to building a healthy and productive community. Our patients are the least likely to get needed health care because they are unable to pay. CHIPS can't do this alone. The total and often complicated care depends on community partners, area hospitals, federally qualified health centers, health departments, and other social service agencies. The nurse-managed model of care includes addressing the needs of at-risk youth in our Club CHIPS program, which you've been introduced. Not to be overlooked is our long-standing Diabetic Support Group and the Circle of Friends groups. shining light on the needs of the elderly community members. Thank you for your support of the CHIPS Nurse Managed model, which is committed to addressing the social determinants of health, built on a foundation of faith and love. And thank you for joining us tonight.
Good morning, evening, friends. Here's your friendly announcer. I have serious news to pass on to everybody. What I'm about to say could mean the world's disaster, could change your joy and laughter into tears and pain. It's that love's in need of love today. Don't delay, send yours in right away. Hate's going round, breaking many hearts. Stop it please, before it's gone too far. Of evil plans to make you its possession, and it will if we let it destroy everybody. We all must take precautionary measures. If love and peace you treasure, then you'll hear me when I say, oh, that love's in need of love. Hey, don't delay, send yours in right away. To break my heart. Stop it, please, before it's gone too far. Don't you know that love's in need of love. Oh, don't delay, send yours in right away. Did you ever know trying to break my heart? You ought to stop it, please, before it's gone too far.
So many memories we've made throughout the years. Looking back on them may fill our eyes with tears. Joyful moments we don't want to fade away, but some will go and some will stay. Turning the corner and not knowing what is there can stir up excitement, but also bring up fear. How we face it is a choice we have to make. Let's stand strong every day.